This is Counterpoint, and I'm your host, Tanya Granic Allen. Once again, as we roll into the end of the year, Canadians are being confronted with heartbreaking numbers, this time from the 2025 edition of the Died on a Waiting List report issued by secondstreet.org. It lays bare the harsh reality during the fiscal year from April 2024 till April 2025. At least 23,000 patients across Canada died while waiting for surgery. It's actually closer to 24,000. These deaths didn't just involve minor procedures. The list ranges from actual cardiac surgeries and cancer diagnostics to also MRIs, hip operations, and other interventions. Some people died after waiting less than a week. Others waited years. The data covers a wide spectrum from potentially life-saving operations to treatments meant to preserve and improve life. Taken in context, this year's toll pushes the total documented number of Canadians who've died on wait lists since 2018 to over 100,000 persons. These are not just statistics. These are lives that are cut short, families left grieving, and of course, a healthcare system facing a crisis of trust. It also raises urgent questions about transparency and accountability and whether our system can truly deliver when lives are on the line. So, to help us unpack these findings and explore what this means for patients and policy, I'm joined today by the author of the report and president of secondstreet.org, Colin Craig. Colin, thank you so much for joining on today to talk about this. I sometimes dread this show. I know we do this every year because things just usually don't show improvement. So, correct me if I'm wrong, but has anything improved in terms of numbers since last year?
Not really. No, no. I mean, all indications are is that the numbers going up. The crazy thing about this, Tanya, is that the government statistics around this issue are pretty horrible. And when I say horrible, is you would expect that government should be tracking this problem so that they can understand, exactly how big of an issue they have, know where to allocate resources to address issues and so forth. But they really don't seem to follow this issue with any kind of purpose. It just seems to be some data they happen to collect, which is a whole other story in its own right.
Yeah, no, it's concerning. And you sort of alluded to that the numbers are likely far higher. How confident are you that they are far higher given the gaps in reporting?
Well, I bet my house on it. I'd be that confident. And I'm not a
Okay.
wealthy guy. I can't afford to lose my house. Um, here's the reality. We tried to look at this issue to find out where people are dying while waiting for healthcare services. So if there's kind of three main points where that could occur. You're referred to a specialist. And while waiting to meet with the specialist, we know those wait times can be very long in this country. So there's the potential you could die there. You could die once you're referred for a diagnostic scan, right? Maybe the specialist looks at you and says, yeah, we should really get your heart checked out or something like that. Or maybe it could be something less significant, such as, problem with your shoulder, whatever it is.
Mhm.
So you die while waiting for a diagnostic scan. And then sort of the third category would be some kind of surgery or procedure that the government has put you on a wait list for. And so when you look at those three, governments really only are able to provide data for two of the three. They generally have no idea how many people are dying while waiting to meet with a specialist. We've received
Wow.
a little bit of information here and there, but generally governments are in the dark. They have no clue how many people are dying at that first stage.
So why aren't they tracking this data? Why aren't they releasing the data or showing a desire, in my opinion, to want to track this data? And why is it beholden to you and your organization to do freedom of information requests just to get this information?
Well, the answer is they should be tracking it, and they should want to know so that they can identify problem areas, and then, like I say, reallocate resources to make sure, hey, let's make sure so no one else dies waiting for a heart procedure, this or
Right.
that, or whatever the situation is. We started to look at this issue because of stories like Laura Hillier in Ontario, young girl died on a waiting list. We wondered how many stories are out there like that because governments don't hold press conferences to bring the data to light. So we wanted to figure out what's going on. And like I say, sadly, they don't even really seem like they follow this data with any sense of purpose.
So we only have about 10 seconds, but has any government contacted you about your research?
No.
Okay. Well, there's that. Okay, we're going to pick up this discussion. It's unfortunately grim, but we're going to pick it up in just a few moments.